The American Health Journal, bringing you the latest information on medicine, psychology, diagnosis, treatment, and prevention. Major medical advances are made each week, and each week the American Health Journal keeps you up to date.
What can you do as a parent if you feel your teen is having an addiction problem? Effective treatments for adolescents with substance abuse or behavioral disorders require an approach that includes attention to every aspect of a kid's life. We spoke with John Lieberman, the Director of Operations at Vision's Adolescent Treatment Centers in Malibu, California, who tells us more on how they can help adolescents with addictions.
It's really crucial that we evaluate adolescents based on them being kids, still being influenced so much by their surroundings, by their families, by their education, and taking into account that the substance abuse issues are profound for an adolescent. Sometimes kids are finding some sense of peace, some sense of connection from the life that they may have engaged in, say from the friends that they have if they're using drugs. But someone might look at that and think, oh, we have a drug addiction here, where maybe you have a child who's coming from a family system that's really disjointed, maybe divorce is going on, and that child may have something like an underlying or overriding depression or anxiety problem.
We asked John Lieberman, what are some of the warning signs a parent should look for if they feel their teen is having a problem?
First sign is that you're concerned that something might be wrong. So then you want to look for things like a change in friends. You want to look for a change in kind of the whole social structure. Does your son or daughter quit going to sports? Does school start dropping off, or things that used to be important, they're not so important? Are they really erasing maybe the history on their internet? Do they not want you to look at their phone and their text messages? Things like that. Maybe you call on the cell phone, find out they're not where they said they were going to be. So the easiest way to find out if there's a problem is you want to know who they're with, when they're there, and what are they actually doing.
We asked Mr. Lieberman, what are some of the adolescent problems the center treats?
We take care of kids who have substance abuse, misuse, and addiction issues, which include things like marijuana, alcohol, ecstasy, a lot of the pharmaceutical drugs that are out there. So we help kids with recovery and being able to stay clean. At the same time, we're helping kids be able to learn to cope with depression, pressure, help stabilize their educational system, and do a lot of work with the family, because ultimately family is where the healing takes place, and family has more to do with these kids getting better than anything else. It's very important to understand that when we treat adolescents, we're also treating the family, we're addressing their educational system, we're addressing their social structure, and maybe their emotional and mental state at the same time. So at Vision's Adolescent Treatment Centers, we have a residential treatment program with 16 beds where kids stay for 45 to 90 days.
We asked John Lieberman what a day is like for an adolescent in treatment.
After breakfast, they might make a call home to their parents to talk about what their plans for the day are. They'll be in school for about 3.5 hours with teaching staff that understands the issues that they're going through. They'll have lunch, then they'll have a group maybe on self-esteem issues, maybe relapse prevention, a family prep group. They might have art therapy or equine therapy. We treat kids anywhere from 13 to 18 years old. We get all different races. We have kids come here from Canada, from England, to Ireland, to New Mexico. We have kids come from all over, and their families actually come in also. Their families are required to participate. Some of our kids come in where maybe the depression or anxiety or substance abuse has been going on for maybe a couple of years. Maybe we have someone who's 17 and a half years old, and mom and dad realize if we don't do something now, we might lose our chance.
John Lieberman tells us the most rewarding thing about working with adolescents at the center.
One of the most exciting things about working in adolescent treatment is watching those kids change. When they grab their dreams again, when they want to go back to sports, when they really want to get back into their education, and when you see those kids have a future again. And it's really important that we deal with that by pulling their families in. When mom or dad says, "There's Johnny again. I thought I lost him, but he's back."
Keeping our kids safe is a #1 priority for parents. If you feel your teen is having a problem, seek help before it's too late. I'm Laura Windsor for the American Health Journal.